This is me Arzu here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 3 video of the pulp and this is our last video of the pulp. In this video of the pulp we will be discussing the functions of the pulp, pulpal blood vessel and the circulation, knobs of the pulp, difference between the primary pulp and the permanent pulp, and the age changes of the pulp. So this age change of the pulp is one of the most important topic of today's video. Also this functions of the pulp is also one of the important topic that is asked in the theory exams. And in the previous video of the pulp we have discussed with the different cells of the pulp. Okay, so the constituents of the pulp, different kinds of cells, different kinds of fiber ground substance we have discussed in the previous video of the pulp. Okay, so in this video we will study about those topics and we will complete the pulp in today's video. Okay, so without delaying much, let's get started. So our content is functions of the pulp first. Okay, so in the functions of the pulp, okay, so it is one of the favorite question of the theory exams. Most of the time, okay, our teacher used to ask this function of the pulp in the theory exams. Okay, so write the functions of the pulp. Okay, so when they ask, okay, so if you write in such a pattern, okay, so I have taken this pattern from the Orbans. Okay, so if you write in such a pattern properly, then they would give a proper marks. Okay, full marks to the answer. So our first function is a inductive function. Okay, so inductive means it just induce other things. Okay, so as I have written here, differentiation of the dental lamina and the enamel organ. Okay, so this pulp, okay, so this pulp helps in the differentiation of the cells of the dental lamina and the enamel organs. Okay, and interacts with the developing enamel organ, determine the particular type of the tooth. Okay, so everything I have discussed in the development of the tooth. Okay, so you can refer to that video and clear your concept about this. Okay, but just for now, just remember pulp have inductive function, so it differentiates the cells of the dental lamina and the enamel organ. Also it determines the particular type of the tooth. Okay, after inductive function we will move to the formative function, and the formative function means it just forms anything. Okay, so it produces the dentin. Okay, so odontoblastic zone of the pulp, okay, it contains the odontoblast which produce the odontoblastic tubules. Okay, and those odontoblastic tubules are responsible for the secretions of the, okay, so the production of the dentin. Okay, so the production of dentin which surrounds it and protect it, and the pulp odontoblastic process and the dentin. Okay, so the pulp odontoblastic process is formed from that and dentin is formed. Okay, so after inductive function, formative function, we have nutritive function. Okay, and in nutritive function pulp nourishes the dentin by the blood vessel of the pulp. Okay, so in the dentin video I think I have told there. Okay, so the dentinal lymph or dentinal fluid that is present in the dentinal tubule. Okay, so that is a ultrafiltrate of this plasma. Okay, and the plasma comes from the blood vessels of this pulp. Okay, and those plasma contain a proper nutrition, so there is a diffusion of the nutrition from the dentinal tubules to the surrounding dentin. Okay, and that nourishes the dentin. Okay, so the nutritive function comes from there. Okay, so the pulp nourishes dentin by the blood vessel of the pulp. After that there is a protective function. So in the protective function we have sensory knobs in the tooth responding to the pain. Okay, responding with the pain. Okay, so this is important. Okay, so responding with the pain with all stimuli such as heat, cold, pressure, operative cutting and the chemical agents. Okay, so in the protective function means with any kind of stimuli, just like heat, cold, pressure, operative cutting. Okay, during the conservative and in the conservative dentistry, okay, we just prepare the cavity. So during the operative cutting and the chemical agents, okay, so all those stimuli would cause a similar response. Okay, so that is a pain, so that response is a pain. Okay, so that is a one kind of a protective function of this pulp. After this, defensive or the reparative function. So in this it responds to the irritation, whether mechanical, thermal, chemical or the bacterial, by producing the reparative dentin and the mineralizing any affected dentinal tubules. Okay, so defensive or the reparative function means, so it responds to the irritation. Okay, whether the irritation is by mechanical, thermal, chemical or the bacterial. Okay, by producing the reparative dentin. Okay, so reparative dentin I have talked in a dentin video, and the mineralizing the affected dentinal tubule. Okay, so sclerotic dentin. So mineralization of the dentinal tubule forms the sclerotic dentin. Okay, so So for here, okay, just you should remember is that, okay, so the function of the pulp, we have inductive function, formative function, nutritive function, protective function, and the defensive function, okay. And the mnemonics is pre-F, okay, pre-F. So you can remember like this way: P means protective, R means reparative or defensive, I means inductive, N means nutritive, F means formative, okay. So you can prepare your own mnemonics too also, and also you can take this mnemonic, okay, to remember all those functions of the pulp, okay. Okay, after this, okay, we will move to the pulpal blood vessel and the circulation, okay. So when you will try to study this topic from the textbook, okay, or from other sources, you will get to know everything, okay. Okay, there are a lot of information, okay, but that much information is not required, I think. So the things that are to be required for you during your exams, okay, exam preparation or any kind of viva, okay, so the notes that I have taken from the book and written here, okay, so that is more than enough, I think, okay. And this is not one of the most important topic of this pulp chapter, okay. So you don't have to worry much in this topic, but the things that I have mentioned here, I think I have covered all those important points, okay. I have taken all those important points from this subtopic, so you should not have to worry in this, okay. And there are a lot of information present in the book about this subtopic, okay. But the things that I have mentioned here, so take that much and just revise all those datas, okay, sorry, all those information, okay. So our first point is that, okay, so it is extensively vascularized, okay. So that means, okay, so there is a presence of the more number of blood vessel, okay. So there is a more number of blood vessel and nerves in the pulp, okay, which makes the tooth vital, okay. So as the pulp is present in the tooth, so the tooth is made vital by the pulp, and the pulp contain vascularized, okay, vascularized blood vessel, okay. So they have proper vascularization, okay, and also they have proper nerves supply. So that is a feature of the pulpal blood vessel. And after that, blood supply is from inferior and the superior alveolar artery, and they are drained by the same veins, okay. So this is, you can remember. After that, small arteries and the arterioles enters the apical canal and pursue a direct route to the coronal pulp, okay. So those small arteries and the arterioles enters the apical canal. So this is a apical canal or apical foramen, and they just enter into this, okay, and they have a proper direct route from this apical foramen to the coronal pulp, okay. It have direct route, and along its course, okay, it gives of numerous branches, okay. So from this apical foramen, when it goes to the coronal pulp, okay, when it moves to the coronal pulp, it gives numerous, okay, so it gives of numerous branches, okay, which pass peripherally to form the plexus in the odontogenic region, and that is called subodontoblastic plexus, okay. So subodontoblastic capillary plexus, okay. So the thing that I wanted to say by writing those points is that, okay, so the small arteries and arterioles, they just get enter from the apical foramen, okay, and also the nerves, okay, they also enter along those blood vessel in this apical pulp canal from the apical foramen. So after entering into the apical foramen, they just move towards the coronal pulp, okay, and along its roots, along its path, okay, it gives numerous branches which pass peripherally to form the plexus in the odontogenic region, okay, and that is called subodontoblastic capillary plexus. And that is the thing, okay, you should remember, okay. So this is a subodontoblastic capillary plexus is present, okay, that is just below the odontoblast, okay. They just move and like this, okay. So they just form the capillary plexus below the odontoblastic zone, okay. So odontoblastic zone is the most peripheral zone of the pulp, okay. I think you are known with that, okay. So after that, okay, in next point, arteriovenous and the venous anastomosis is present there, okay. So it is sure that there will be anastomosis. After that, pulpal blood flow is more rapid than the other part, okay. So this is, you can remember, okay. So the blood flow that of the pulp is more rapid than the other parts of the body, okay. So you can remember this. So the blood flow rate, okay, so the blood flow speed of the blood flow is more rapid in this pulpal blood flow than the other part of the body. After that, in the next point, so the pericyte and the capillary associated fibroblast, okay. So this is one of the important, okay. So this is VBI, so this is important. So the pericyte and the capillary associated fibroblast, okay, so they are the different kinds of cells that are present on the walls of the small arterioles, and those cells have the contractile properties. So as they have the contractile properties, they just contract and controls the blood flow of the small arterioles. Okay, so you see it is important here to know. Okay, after that, when the blood vessel enters the pulp, okay, so when the blood vessel enters the pulp, okay, so the coronal pulp, it is trying to say coronal pulp, it increases in the lumen and reduction in the vessel thickness. Okay, so there is increase in the lumen and decrease in the vessel thickness. Okay, so as the blood vessel enters into the coronal pulp. Okay, so I'll write C here. Okay, so coronal. Okay, so blood vessel enters the coronal pulp. After that, veins may be larger than the arteries, and those are present on the central part of the pulp, and they have irregular walls than the arteries. Okay, so the veins, okay, so they are mostly, okay, so the veins that are larger than the arteries. Okay, so in the general physiology, I think you know this. Okay, so first of all, there is artery, then there is capillaries. Okay, so then there is capillaries, and those capillaries, after those capillaries there is vein. Okay, so this is artery, this is capillary, and this is vein. Okay, so this is simple concept. And these veins, okay, so if these veins are larger, okay, so mostly those veins are larger than arteries, and those larger veins are present on the central part of the pulp. Okay, and they have irregular walls than that of the arteries. Okay, so you can remember this. Okay, after completing the blood vessels, we will move to the lymph vessel. Okay, and in this lymph vessel, okay, so the lymph vessel, okay, so in the lymph vessel, okay, first of all, lymphatic vessel are more numerous in the central part of the pulp than the periphery. Okay, so it is a bit similar with that of the veins. Okay, so this the function of this lymph vessel, I think you know from the general physiology. Okay, so the lymph vessel function is that, okay, it just take the interstitial fluid. Okay, so it just take the interstitial fluid. I just think. Okay, so the blood comes, just listen to me, so the blood comes from the arteries and it goes into the capillaries, and in the capillaries there is an exchange of the gases. Okay, so there is an exchange of the gases. Okay, so there is an exchange of the gases, and during this exchange, okay, so also there is action, and also it pour some nutrition there. Okay, so the fluid that comes from this capillaries and stays in this space. Okay, so this is an intercellular space. Okay, and from that space, and it is drained, so that fluid that is present in that space is drained by those lymph vessel. Okay, and those lymph vessel finally drains into the vein. Okay, okay, so I think you know this. Okay, so I wouldn't enforce much in this, but just listen to me. Okay, so the blood comes from arteries, okay, and it reaches the capillaries, and at the capillaries there is a gaseous exchange. Okay, we everyone know it. Okay, after that, when there is gaseous exchange, there is also a exchange of the nutrition. Okay, so nutrition, okay, so there is also exchange of the nutrition, and that is in the form of the fluid. So the fluid, when it comes out from the capillaries, and it is coming in this interstitial space. Okay, so interstitial space is the space between the two cells. Okay, so in those space, okay, so those fluids, okay, that are finally drained by this lymph vessel, and those lymph vessel finally takes all those interstitial fluid and finally drains into the veins. Okay, and also some of the blood, after exchanging the gas, okay, they directly drains in the veins. Okay, so the finally blood is going to be drained into the vein. Okay, so that is a, I think, general concept, you everyone know it. Okay, so those lymph vessels, okay, are also present in this pulp, and those lymphatic vessels are more numerous in the central part of the pulp than the periphery. After that, lymph capillaries are described as the endothelium lined tubes. Okay, so they are also endothelium lined tubes, okay, and that joins the thin walled lymph vessel or the veins in the central pulp. Okay, so the thing that I have told here, okay, so it collects the fluid from the interstitial space and just drain into the vein, and they join the thin walled lymph vessels or the vein in the central pulp. Okay, so those lymph vessel or the veins, okay, so it also drains into the veins or the thin walled lymph vessel. Okay, so that is written here. After that, cellular projections arise from the endothelial cells. They contain the multivesicular structure, webbed palate bodies, and the paracrystalline inclusions are present there. Okay, so it is not important, but also you can remember. Okay, so there is a cellular projection that is arising from the endothelial cells of the lymph vessel, and they contain the multivesicular structures. Okay, multivesicular structures are present there. like Weibel palate bodies and paracrystalline inclusions. Okay, after that, in the next point, okay, so in the anterior teeth region, okay, so in anterior teeth region, the lymph, okay, from this anterior teeth region is drained into the submental lymph nodes, and in the posterior tooth it is drained into the submandibular lymph node and the deep cervical lymph node. Okay, so anterior teeth it is drained into the submental lymph node, and the posterior teeth it is drained into the submandibular lymph node and deep cervical lymph node. Okay, so you can remember this. Also, I have told here, inferior and the superior alveolar artery gives the blood supply to the pulp. After that, discontinuous present in the basement membrane and absence of the RBC with the presence of the lymphocyte. Okay, so as this the fluid, okay, that is present in the interstitial space, that is ultrafiltrate. Okay, so that is ultrafiltrate and it doesn't contain the RBC, so there is absence of the RBC with the presence of the lymphocytes. Okay, so discontinuity is present in the basement membrane and there is absence of the RBC with the presence of the lymphocyte there. Okay, so due to the presence of this lymphocyte, they are called the lymph vessel. Okay, I think many things that I have discussed here, okay, you have studied in your general physiology. Okay, so the thing that you should remember from this pulpal blood vessel and circulation is that just small points. Okay, just like where is from the blood supply is from where. Okay, similarly this subodontoblastic capillary plexus is important here. Similarly this pericyte and the capillary associated fibroblast is also important. You should remember this. Another important thing is that, okay, about this lymph vessel, okay, so they have thin walled lymph vessel, so they have endothelium lined tubes, okay, and they have finally drains into the thin walled lymph vessels or the veins. Okay, after that they are mostly present in the central part of the pulp, similar with that of the larger veins. So you can just correlate those and just remember that. Okay, and this topic is not much too important. Okay, after that, knobs of the pulp. Okay, so in the knobs of the pulp, so the knobs enters the pulp through the apical foramen along afferent. So this is afferent blood vessel and together forms a neurovascular bundle. Okay, so previously I have told, so it just enters into the pulpal canal with, okay, along with the blood vessels, along with the afferent blood vessels. Okay, and together form the neurovascular bundle. After that, each nerve fiber provide the several branches. Okay, each nerve fiber provide the several branches. Those branches form ultimate complex nerve plexus in the cell-free zone of the wheel called the subodontoblastic plexus of the Rasco. Okay, so I have discussed about this in my first video of the pulp. So there is a presence of the subodontoblastic plexus of the Rasco in the cell-free zone of the whales. Okay, so this plexus is formed by those nerve bundles that are entering from the apical foramen. After that, nerve bundles, as they ascend coronally, they myelinate. The myelinated axon gradually loses their myelin coating. Okay, so as they move to the coronal pulp, okay, so they just lose the myelination. So the myelination of the axon is loosed, okay, gradually. And similar point was there in the blood supply also. As the blood vessel, okay, as it moves more coronally, okay, there is the walls of the blood vessel, okay, it becomes thinner. Okay, and the lumen becomes larger. Okay, so I have written here, so you should relate like that. Okay, so there is increase in the lumen size and reduction in the vessel thickness. Okay, so similar here. Okay, as it moves to the coronally, okay, as they ascend coronally, the myelinated axon gradually loses their myelin coating. Okay, after that, in the nerve bundle enters tooth consist primarily knobs of the sensory afferent knobs of the trigeminal nerve. Okay, so sensory afferent knobs of the trigeminal nerve or the sympathetic branches from the superior cervical ganglion. Okay, so you can remember this. Also, it is not too important, but also you can remember this. Okay, so the nerve bundle that comes in the pulp is from the sensory afferent knobs of the trigeminal nerve. Okay, so trigeminal nerve is a cranial nerve. Okay, fifth cranial nerve. Okay, after that, sympathetic branches from the superior cervical ganglion. Okay, so in the next point, okay, so the proportion of the unmyelinated nerve, okay, so it is more coronally than radiculary, so it comes from this point. Okay, as it moves the coronally, the myelin sheath is lost. Okay, so the coronally there is more proportion of the unmyelinated nerves. Okay, so in after this, so another only free nerve endings are present in the pulp, so only pain sensation is felt there. Okay, so this is also important. So in the pulp, okay, so you can remember this, there are only presence of the free nerve endings, okay, so there is a free nerve endings, so the pain sensation is only present in the pulp, okay, so the sensation that is only present in the pulp is the pain sensation. Okay, after this, myelinated or the fast conducting A delta fiber mediates the sharp pain. Okay, similarly A beta fiber, it just take the information of this mechanical stimulation. After that, non-myelated or the slow conducting C fiber mediates the dull pain, and the sympathetic fibers end in the blood vessel to controls the blood flow. Okay, so A delta fiber, it just mediates the sharp pain, and C fiber mediates the dull pain. Okay, and it is fast conducting, so the myelinated nerve fiber is a fast conducting, non-myelinated is a slow conducting, and A beta fiber, they take the information. Okay, and they are also myelinated and fast conducting, but they mediate the information, they just transfer the information of this mechanical stimulation. Okay, after that, in the last point, the sympathetic fiber ends in the blood vessel to controls the blood flow. Okay, 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 so we have completed this knob of the knob of the pulp. So our second last topic is the difference between the primary and the permanent pulp. So this is also not much important topic, okay, but also I have written some points, so you can go through those points. Okay, so primary pulp, permanent pulp. So primary pulp means that pulp that is present in the deciduous teeth, okay, or the primary teeth, and permanent pulp is the pulp that is present in the permanent tooth. After that, functions for the shorter time. Okay, so the primary pulp, it functions for the shorter time and it functions for the longer time. Okay, so permanent pulp, as the permanent tooth lives for the longer time, so it functions for the longer time, and it functions for the shorter time. After that, associated with the larger pulp chamber, wide pulp horns, and small pulp chamber due to the deposition of the secondary dentine. Okay, so there it have a larger pulp chamber, and there it have a smaller pulp chamber. Okay, it is formed during the tooth development, and after the root formation it is completed. Okay, so during the tooth development, primary pulp is formed, and after the root formation, okay, so when the root formation is completed, after that the permanent pulp is formed. Okay, and odontoblastic is highly active in the dentine formation here in primary pulp, and it is slightly reduced in permanent pulp, and blood vessel and the circulation is rich in the abundance. Okay, so blood vessel and circulation is rich and abundant. Okay, after that it is less here. Okay, so some points are here. Okay, so primary pulp, deciduous teeth, this is permanent teeth, shorter time, larger time, associated with the larger pulp chamber, larger horns. Okay, and smaller pulp chambers, it is formed during the tooth development, it is formed after the root formation. Okay, so you can remember like secondary dentine, so secondary dentine was formed after the root completion. Okay, so similar for the pulp, so it is also formed after the root formation is completed. Another point, odontoblast is highly active in this primary pulp, so it secretes the dentine in a high quantity. Similarly, this permanent pulp, it is slightly reduced, and blood vessel and circulation is rich and abundant here, and it is less here. Okay, so you can go through those points and remember those points. Okay, okay, so our last topic and the most important topic of today's video is the age changes in the pulp. Okay, so there are different kinds of changes that we can see in the pulp with the time, with the age. Okay, so those changes are written here, so just we will go through that. Okay, so in the cell changes, so in the cell changes, with the increase in the age, there is decrease in the cellular components and decrease in the cellular numbers. Okay, so there is decrease in the cellular components, so the cellular components, they just get decreased, and also the number of the cell, they get decreased. Okay, and the fibroblast exhibits less perinuclear cytoplasm and poses long thin cytoplasmic processes. Okay, so the fibroblast is a type of the cell that is present in the pulp. Okay, so it is a most predominant cell that is present in the pulp. So I have discussed with this fibroblast in my second video. So this fibroblast, they exhibit less perinuclear cytoplasm and poses the long thin cytoplasmic processes. Okay, long thin cytoplasmic processes, it get developed in this fibroblast. After that, the fibrosis, so there is accumulation of both diffuse fibrillar component and the bundles of collagen. Okay, so there is increase in the fibrillar component, diffuse fibrillar component, and bundles of the collagen is also increased in the pulp with the age. Okay, and increase in the fibrosis is generalized throughout the pulp organ. Okay, okay, so the point it wants to tell us that, okay, so the fibrosis, we know that with the age it increases, and the fibrosis that is present in the pulp, okay, it occurs in the pulp, it is generalized, which means that it is not accumulated in a certain part of the pulp, but it is generalized throughout the pulp, okay. So in such a pattern there is increase in a fibrosis. Also there is accumulation of both diffuse fibrillar, so you can remember this. After that we have discussed with the cell changes, with the fibrosis, and in the third point vascular changes. So atherosclerotic plaques appears in the pulpal blood vessel, okay. So atherosclerotic plaques we can see in the blood vessels. Another thing, collagen fibers deposition in the medial and the adventitial layer. So the outer diameter increases but the lumen remains the same, okay. So the wall thickness is increased with the time, and it is done by the collagen fiber deposition, okay. So in the next point now, in the endothelium in elderly shows numerous pinocytic vesicles, microvesicles, and the microfilaments, okay. So pinocytic vesicles are present in the endothelium, microvesicles and the microfilaments are also present in this endothelium. Another point, calcification are found surrounding the vessels, okay. So the calcifications are found surrounding the vessels, so calcification is also there, and that is surrounding the blood vessel, okay. So in the vascular changes, you just remember atherosclerotic plaques, calcification, and collagen fiber deposition on the walls of the pulpal blood vessels, okay. So in another point now, pulpal stones and the denticles. So this is one of the important topic, okay. So this pulp stones or the denticles are the discrete, okay, and nodular calcified mass, okay. So as I have discussed with the calcification here, and it is surrounding the vessels, so there is a discrete nodular calcified mass here, and that is appearing in either or both the coronal and the radicular portion of the pulp, okay. So it may be present in the radicular pulp or in the coronal pulp, and it is discrete in nature, nodular calcified mass appearing in either or both the coronal and the radicular pulp of the portion of the pulp, okay. After that, usually they are asymptomatic unless they impinge the nerves or the blood vessel, okay. So those pulp stone or the denticles are asymptomatic, and they have no any kind of symptoms, okay. They do not show any kind of the symptoms, but when they just grow in a size and impinge the nerves or the blood vessel, they show with the different kinds of symptoms there. So in such a case, this pulp stone and denticles will be important, okay, and it will be significant there, okay. So the pulp stone we classify in the two bases, okay. So one basis is the resemblance with the dentine, and another is the its location, okay. So the true pulp stone is the pulp stone that is resembling with the dentine, means it is similar with the structure of the dentine and usually rare and are found near the apical foramen. And those false pulp stones are the concentric rings of the calcified materials and not resembling with the dentine, okay. So they are not resembling with that of the dentine, okay. So one is a true pulp stone, another is a false pulp stone. So true pulp stone, it resembles with the dentine, and the false pulp stone, it doesn't resembles with the dentine, okay. So the resembling with the dentine means it contain the dentinal tubules. So this true pulp stone, they have dentinal tubules, they don't have dentinal tubules, this pulp stones. And another classification is the free, attached, and embedded. So free means it is totally surrounded by the pulp, okay. So there is no any kind of dentine present around it. Another is attached, means it is 50% present in the pulp or 50% present in the dentine, okay. Not just 50%, but just take a concept like that, okay. It is present in both dentine and the pulp, so partially attached to the dentine, okay, and partially also attached to the pulp. After that, embedded. So embedded means it is completely within the dentine, okay. So true pulp stone, false pulp stone. Another classification is free, attached, and embedded, okay. So in such a pattern you can classify those pulp stone, and they are important, okay. They are going to ask this question every time from this chapter, okay. So this is one of the most important topic of this chapter. You should remember this: true pulp stone, false classification of this pulp stone, and free, attached, embedded, okay. After that, another change is that the diffuse calcification. So irregular calcific deposit in the pulp tissue, usually following the collagenous fiber bundle or the blood vessel, okay, and usually present in the root canal, but denticles are seen more in the coronal pulp, okay. So they are, this diffuse calcification means just simply the calcification, okay. and they just surround the blood vessel. And this diffuse calcification is usually present in the root canal. Okay, so the pulpal canal, it is present there, and in the denticles are seen mostly in the coronal pulp. Okay, so you can remember this point. So this diffuse calcification is similar with that of the calcification. Irregular calcific deposits are seen in the pulpal tissue, usually following the collagenous fiber bundles or the blood vessel. Okay. Okay, just look once this picture. Okay, so in this picture we can see different kinds of the pulp stone are present there. Okay, so this is a pulp stone. Okay, so this is a free pulp. Okay, as it is present properly in the pulp and it is not surrounded by the dentin. Okay, it is just surrounded by the pulp all around. It is surrounded by the pulp. After that there is a attached pulp stone, so it is attached with the dentin. Okay, it is partially attached with the dentin, and this is a embedded pulp stone and it is properly inside the dentinal tissue. Okay, so it is similar with that of the, so it is true pulp stone too. Okay, so it resembles in the structure with that of the dentin. Okay, but the picture only just wants to show us that free, attached and the embedded. Okay, so just this is a free pulp stone, this is a attached pulp stone, and this is a embedded pulp stone. Okay, so we have completed with this chapter. Okay, so in the next video we will start the new chapter in this dental histology series. Till then, stay happy, stay healthy, and I will meet you in the next video. Tata, bye bye, thank you. And also, if you love this video, please do like, subscribe and share with your classmates. Okay.